Michael, and this is California. And one of the biggest expenses that seniors have throughout their lifetime is their prescription drug costs. And many seniors struggle with these costs and do not realize there's actually help to pay for their prescription drug costs, their deductibles, their copays, and coinsurances through a program run by the Social Security Administration called the Low Income Subsidy Program, or LIS. Or really, as many folks know it, just simply as extra help. And there's nearly 14 million seniors who were on the program in 2017, and that number has only grown up till today. Now, the program is based on income and household size, and it can help bring someone's prescription costs down to as low as $1.30 per prescription. So today, we're going to discuss the Low Income Subsidy Program, or LIS, that assists seniors bring down their medication costs, how it works, and who is eligible. Now, before we do that, if you like this information, if you find it interesting, if you find it helpful, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos become available. The Low Income Subsidy Program, or LIS, is a program that is run by the Social Security Administration. It is designed to help low-income seniors pay for their Part D and their prescription drug costs, and has varying levels of assistance based on people's income and household size. And as a program, it is distinct from Medicaid and Medi-cal, so it doesn't have the same income restrictions as well as asset restrictions as Medicaid or Medi-cal. And one of the really common things that a lot of our clients think is that because they're not eligible for Medicaid or Medi-cal, they think they're automatically not eligible for any other assistance program. And this is simply not true. For example, because the LIS program has higher income and asset limits, many people who are eligible for LIS are actually not eligible for Medicaid or Medi-cal, but can still get the LIS assistance. So there are a variety of ways to be eligible for LIS. First, you must be eligible for Medicare. Additionally, if you're already on another low-income program, so things like Medicare Savings Program, or Medicaid or Medi-cal, or SSI, or maybe even SNAP, then you will usually get automatically enrolled into the LIS or Extra Help program. If your income is a bit higher, then you may get sent a letter from Social Security asking you to apply for LIS because they think you might be eligible to get additional benefits. Also, if your income is under $19,380 for a year for a single person, or $26,100 a year for a couple, then you'll likely be able to get one of the levels of coverage under LIS. Now, there are some asset limits to the plan, but it's important that you understand that things like the home that you live in, the car that you drive, and your personal possessions like jewelry are not going to be counted against you for your eligibility for the LIS program. Also, LIS is not subject to estate recovery. This means that they will not come back to your state to collect money for any benefits that you received under the LIS program. So there are actually 4 levels of LIS, which are all based on someone's income size and household size. And as your income goes up, you get a different level of LIS to help you pay for your prescriptions. Usually, the less money you make, the more benefit you'll get, and the more money you make, the less benefit you'll get. Now, for example, level 1. These folks may or may not have Medicaid or Medi-cal. That's based on their income because it's a very specific income range for level 1. That's for folks who have incomes between 100% of the federal poverty level and 135% of the federal poverty level. So for a household of 2 people in 2020, that would mean that the income is below $23,514 a year, but above $17,240 a year. And these folks may automatically get enrolled in LIS if they're on the lower end of that income scale and they have Medicaid and Medi-cal. But if they're not, their income's higher, they won't be automatically enrolled and they'll have to enroll into LIS manually. Now, for folks who have LIS Level 1, this will change their prescription drug costs down to $3.60 for generic prescription drug copays and $8.95 for brand name prescription drug copays. So people on LIS Level 2 will usually have the lowest income, and usually will have both Medicare and Medicaid and Medi-cal, and have a household income that is less than 100% of the federal poverty level. So for a household of 2 people in 2020, that would mean their income would be less than $17,240 a year, or $1,436 a month. And they usually be automatically enrolled into LIS when they enroll into the other programs like Medicaid or Medi-cal. And for these folks, their prescription drug costs will go down to $1.30 for generic prescription copays or $3.90 for brand name prescription drug copays. For level 3, these folks are usually going to be institutionalized. And we're going to have to make another video for it because it is just too much for this one single video. So we're not going to cover it today. And then finally, for level 4, these are folks who usually have the highest level of income, but they're still not eligible for Medicaid and Medi-cal, and make an income below 150% of the federal poverty level. That means for a household of 2 people in 2020, that means their income is going to be less than $26,100 a year or $2,175 a month. And these folks will actually need to actively apply for LIS because they will not get automatically enrolled into the program. And for people with LIS Level 4, their drug costs will go to a 15% coinsurance first, and then their drug costs will go down to $3.60 for generic prescription drug copays and $8.95 for brand name prescription drug copays. So aside from bringing down the cost of prescription drugs, there are 2 special benefits to getting the LIS program. The first one is that if you're eligible for LIS, it will get rid of any Part D late enrollment penalty that somebody has. So for example, if somebody enrolled late to Medicare Part D and there's a penalty that accrued, it means that once you get LIS, it will remove that penalty permanently. So regardless of whether you stay on LIS or not. The second one is it allows recipients to change their Medicare plans 1 time every quarter. So that's 4 times throughout the year, rather than only once throughout the annual election period like folks who normally only have regular Medicare. So even if you're not taking any medications, if you're eligible for LIS, there are still some great advantages to getting the program. There are a few ways to apply for LIS, and luckily you can apply anytime throughout the year. You simply go to the ssa.gov website and you can apply online. Also, you can apply by a paper application. And I'll put the links for the SSA website as well as the paper applications in both English and Spanish down below in the comment box for you all to have. One final note is that LIS is not automatically renewed for all levels. So if someone does have the LIS levels for higher income, they may have to reapply every single year. Now, overall, LIS is a great benefit for people who are eligible, and it helps Medicare recipients save thousands of dollars a year on their prescription drug costs and can assist people avoid penalties as well as enrollment limitations. So if you think you might be eligible for this program, please don't hesitate to apply. Thank you so much for watching our video, and I hope that you found it interesting or helpful or at least useful. And if you did, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos become available. Also, if you have any comments and questions, leave those down below. We love to see your comments and questions, and we'll be happy to make a new video or a new post as soon as we can to address them. Now finally, we here at California, we know health insurance. So whether it's Covered California or Medicare or Medicaid or medi-cal or private health insurance or even health insurance for a small group, we know health insurance. Because I know it can be very complicated coming out of your work insurance and going on to private insurance. Or maybe you're turning 65, you're trying to figure out which Medicare option best fits your needs as well as your budget. Or maybe you're coming out of a program like Medicaid or medi-cal and now you have to get health insurance on the private side. We can help with all those. So if you have questions about your health care, put those down below and we'll make a new video or a new post for those as well. Now other than that, I am Michael and this is California, wishing you a happy, healthy day.